Welcome to this year's ISNTD Festival. If we haven't met before, my name is Marianne Comperet and I'm from the International Society for Neglected Tropical Diseases. I'm speaking here in London in the UK. We're truly delighted to welcome you to what is our 5th annual festival. It's been both an adventure and a journey over those 5 years, exploring the incredible and numerous ways in which we can best innovate in communication about global health issues and specifically tropical diseases, and that whether it be around the research, new technology, programs, but also, and most importantly, affected people and their communities. At the same time, though, this year does feel like a bit of a new beginning. After a year of what has been no less than a global pandemic, firstly, we are quite predictably for 2021 online, and that is opening up a wonderful new chapter for global cooperation. But also, this festival is taking place in the United Nations officially ratified International Year of the Creative Economy for Sustainable Development in a resolution endorsed by no less than 81 countries. So let's turn back for a moment to the massive shockwave that the COVID-19 pandemic has been. And between the facts and the unknowns, the science, the misinformation, what has changed in the way we want and the way we deliver communications about global health? And so to kickstart this festival in this remarkable year, it's my utmost pleasure to welcome our very first panel, who over the next 90 minutes will be discussing and unpacking these complex issues. Our panelists are coming from very different approaches and roles, and so please join me in welcoming very warmly our first panel. And I've got here with me today, first and foremost, Gabriella Stern. Hi, Gabriella.
Hi.
Hi, you're Director of Communications at the World Health Organization. We're also joined by Dr. Pauline Paterson. Hi, Pauline. From the Vaccine Confidence Project, based at the London School of Hygiene and Tropical Medicine. We're thrilled to be welcoming as well Elizabeth Merab. Hi, Elizabeth. Elizabeth, you are an award-winning health and science journalist with the Nation Media Group in Kenya. And finally, a very warm welcome to Steve Maud. Hi, Steve.
Hi.
Steve, you're a filmmaker and founder of Cloud9 Media, a film company based here in the UK. So without any further ado, let's go back and think a little bit about the past year. What has this meant in terms of the news, the information, the healthcare communications we've all seen, and how have we all, whether as a science community or as an audience, adapted and reacted to that? I think first and foremost, we'd like to find out from you, Elizabeth, since you are the bridge as a science and healthcare journalist between the hard science and the wide public. Just based on your experience, Elizabeth, what have you seen change in the audience's appetite for healthcare information, for news reporting in this field, and have you had to change your approach to this work at all?
Thank you. Let me start by saying that everything has changed in terms of news, in terms of how we cover information, in terms of the information we disseminate. When I look at most of the work that I do compared to 2 years ago, I am mostly covering a lot of COVID stories, from research to what is happening locally at home. And when I look at the audience, for us, we have different people who are looking at audience engagement, but generally from my own personal experience, I've found that now, beyond speaking to the public and trying to explain the science in simple terms, I find myself with a bunch of editors who I also have to not only pitch the story to, but also explain the science, because they're the people who okay the stories that run, the stories that we cover. So if they don't understand really what you're talking about, then they will not, they will most likely dismiss it. So every morning when I go into meetings, the first thing that I have to really be aware of is that I'm speaking to the first lay audience that I have to meet are my editors. If I might put it that way. And therefore, it means that every time I look at a story, or I look at a study or information that is put out there by organizations responsible for informing us of what is happening, I have to look at it from the simplest point of view. I'm always told, always try to communicate as if you're communicating to a 2-year-old person, or a 2-year-old child, or a grandmother. So I have to bring in all these audiences into one story every single day. That has really changed. Some time back I'd do a story, and specifically I'm writing to target scientists, or I'm writing to target policymakers.
That is really interesting, Elizabeth. And I suppose what communicators are always told is know your audience. But of course, what happens when your audience is everyone? We now have children in playgrounds discussing vaccine rollouts or herd immunity. And as you say, grandparents perhaps coming from a different angle. So trying to really work towards that common denominator is very difficult. And very interesting what you said about your editors as well. It reminded me, we once had a conference. It was on quite specifically on drug discovery and diagnostics. And one person in one presentation mentioned that a platform they were using was akin to a speed dating concept. And so a lot of the press coverage was about the speed dating aspect, despite there being 2 days worth of, really incredible hard science. So do you find that with your editors, something like that, something that really is maybe, something that a broader public might relate to more easily, would that catch your editor's attention more than perhaps more dry science?
Definitely. When you look at almost 70% of the news we cover, it's politics, yeah? And then you find that entertainment is more appealing. I think there's this notion that science is complex, but the understanding that science is in our everyday, we interact with science every single day, and we interact with our health every time we step out of the house, or wherever we are. We have to appreciate our health. But if you are to communicate that to an editor, and also to the general public at the end of the day, you have to make it appealing to them. You have to make that science appealing, and not only understandable, but also appealing, so that somebody who's reading it does not feel like they're reading the Lancet. You want to move away from the Lancet to a news segment that somebody can appreciate and understand and interact with, and also share on social media, because we are sharing information left, right, and center today.
Absolutely. And I suppose, like many of us here connected today, your home or your work was filled with the soft tones, or sometimes not so soft tones, of voices of Dr. Tedros from the WHO, Dr. Maria Van Kerkhove, Dr. Mike Ryan. They kind of paced our lockdown with the daily briefings. And so I was just wondering how helpful was the World Health Organization in kind of steering your journalism? Did you have to not only kind of keep afloat with the information, but did you also have to educate yourself in misinformation in order to counteract it?
Well, we all, maybe I I think it's something that we all share as journalists wherever we are. We have found ourselves having to really educate ourselves in knowing the difference between misinformation, disinformation, and what is fake news that is filling and flooding our social media pages, because even the media has fallen prey to fake news. And I mean, I cannot blame them, because I have found myself doubting some information that I've received. You see something that has been put out with all these banners written UNICEF or WHO, and you know that these are the organizations that you go to, the entrusted organizations that you go to get information, only that somebody else has created that impression that the information came from these organizations when it actually never came from them. So we are finding ourselves in a situation where you in a situation where you not only have to put out accurate information, but you also have to be very careful on the kind of information where you're getting that information from. And I mean, like I said, I cannot blame journalists for falling prey to fake news. We have seen, and there was a time when the pandemic was starting and everyone was thrown into a disarray. We could see even organizations like the Lancet and the New England Medical Journal. They had to retract some scientific studies they had put out, And when you find yourself now, yesterday you had reported that information, today it's been retracted, then you're in a situation where now, do you doubt it or do you trust it, And it means then that you have to go back and really sift through a lot of information and look through a lot of organizations to understand that actually this is the true stand, or this is an actual thing that happened, and this is not something that happened. It's only yesterday that hours after AstraZeneca put out information about their trials, their study trials, their clinical trials, we saw health officials in the US put out a statement almost hot on the heels of these trials, And then now you have two sides of the same coin, and you don't know how to merge it, yeah? So education, it's a constant education moment, and it's a constant you keep updating the information that you have. I think that is the simplest way I can put it. I have to keep up with the information literally, so that I put out the accurate information for my audience.
Elizabeth, thank you for that. And we really applaud your dedication over the last 12 months to keeping us informed and keeping track of all this. So thank you so much. And I think you've mentioned kind of WHO always checking that your sources are accurate and so forth. And perhaps this would be a good moment to ask you, Gabriella, about in terms of what you were doing at the WHO over the last 12 months in general. Has this been one of the major challenges that COVID has brought upon, is to kind of not just make sure your communications are accurate and relevant, but also keeping an eye on what's out there in your name?
Yeah, you can hear me, right? Is the audio
yeah,
okay?
Absolutely.
Elizabeth has really brilliantly captured what pretty much everyone who is in communications, broadly defined, whether it's media, social media, communications for an organization, and other, has had to grapple with. It has been incredibly hard. It's hard. what she described, having to differentiate between what is evidence-based and science versus hoaxes and misinformation. That's, everybody has had to deal with that, and it's really hard. The challenge of having to, communicate with different audiences in their language in ways that they can understand. Is it a 3-year-old? Is it a 10-year-old? Is it a grandma? Is it really, really hard? What you said, Elizabeth, about the AstraZeneca has happened so many times over the past, 14, 15 months, where something has evolved. Our knowledge has evolved. This was a new virus, and pretty much every hour of every day, we've learned something new about the virus, or how to protect people, or whatever, or new vaccines. I think this has just been so hard, and so many people across the spectrum of communications have really tried their best. And when I go home at night, sometimes I just think it's remarkable, the sort of collective effort of reporters and editors and communications people and creative people like Stephen, and people who focus on helping people navigate misinformation. It's been a huge collective endeavor. It's been very hard, and we've learned a lot. And I think there will be PhD theses written for decades to come on what we learned, what worked, what didn't work, and how we apply these lessons to communicating about health and everything else going forward. I mean, I have my own thoughts on how I would flip the equation. If I were to do it over again, I would do a lot of things differently. And actually, because the pandemic's not over, we're trying to actually apply those lessons as we go. For WHO, our audiences are varied, right? We have to communicate to experts, to scientists, to Nobel laureates, to people who know way more than certainly I do in communications, and we need to communicate to children and everyone in between. And we have to do it in languages. We have to reach people who are going through different kinds of traumas, whether they're refugees, migrants, essential workers who are being exposed to the virus through the jobs they do to keep us fed and safe and so on. Of course, health workers. So that's a huge challenge. And then communicating about evolving science, really hard, because as much solidarity as there has been across the world during this outbreak, there's also been this kind of zeitgeist of finger pointing and blame. People are very quick, and it's because they're exhausted and angry and traumatized. And so it's been hard, because when we learn something new and evolve some guidance, a lot of people say, oh, okay, we've learned something new, we'll adapt our behaviors. But other people go, how come you didn't know that sooner? And of course, we beat ourselves up internally. How come we didn't know that sooner? Could we have, should we have? But then you've got to just move forward. And so you have this strange kind of existence in communications at WHO, and broadly, I think, with other agencies, whether they're Africa CDC, US CDC, European EMA, national ministries of health, etc., where you're trying to move the knowledge forward. You're trying to communicate to people ways to keep themselves safe, encourage countries to do the right thing, but you're also facing this barrage of, why, and it's been actually quite traumatic to do comms. I know it sounds, cue the violins. We are very lucky to have these roles, but it's been hard. So I'll pause there, but there are a few other things I want to say in the next hour about how lessons learned and how communications should change going forward.
No, that's That's been really interesting, Gabriella, and I'm glad that you actually mentioned it's been hard, because it's something that I often feel for anyone in communication at this point in time, because I'm sure it's okay to not know everything right from the start, and just to, as audiences, being a little bit forgiving on that side of things is fine. And actually what's been very impressive at WHO, and I'd like to ask you more about that, is when everyone didn't know, you always had the right tone to still inspire confidence. And I think, we can talk about it in context of the AstraZeneca vaccination pause. We'll come back to that in a moment. But my question would be, how important is your manner of communicating versus the actual content, particularly when we don't know?
Yeah. No, what we did from day one, and my background is I was a journalist. I'm 60 and I was a journalist until age 55. So I have that that's who I really am fundamentally, even though, of course, I'm at WHO doing communications. And so from day one, we decided to be in a constant conversation with the world, constant. And then we did that through having press conferences. We've had at least 150 press conferences since the outbreak began. And the reason I don't know the number is because recently we're in the high 140s, and then I haven't counted it up lately. For a while, we were doing daily press conferences. Then we went to 3 times a week. Now we're at 2 times a week, but we're religious about it. And sometimes we add press conferences. That's number one. So we put ourselves out there. Dr. Tedros, Dr. Ryan, Dr. Van Kerkhove, who are the main faces, and also our chief scientist, Dr. Swaminathan, and many others. We put ourselves out there to answer media questions all the time. We also do lots and lots of social media lives where we get our experts and guests live on all our social media platforms to answer questions all the time. We also, our media team is also always, we've got some surge capacity, so we're always there to take media questions via email or phone call. The reason I'm telling you this is because this then allows us, by being in constant dialogue with the world through media or directly to social media followers, to the public, we're able to help them navigate these inflection points when we learn something new, or there's a setback, or people are confused. So, and it also allows us to course correct in real time. So if we say something on a Monday that we need to correct or modify or clarify, we can do so Monday night or Tuesday morning, and we have done that. And then, of course, we have, we can send out blasts. We have a media list that has tens of thousands of people on it. So to me, this kind of interactive, transparency, authentic engagement is the foundation of how you navigate, how you communicate in a changing, difficult environment.
And that's certainly been much appreciated by everyone. It's true. It is staggering the amount of presence that you've had across numerous social media, whether it be an animation form on Facebook, all the way to, as you say, these not impromptu, but sort of very, quick turnaround on these live events. So it's been most helpful. And I suppose one of the main challenges in all of this would have been around vaccination, as that conversation kind of started to come again at the forefront after about 3, 4, 5 months into the pandemic. And I suppose that's a good time to ask Pauline about some of your observations at the Vaccine Confidence Project. So building on what Elizabeth and Gabriella have just said, listening to those audiences is something that you're familiar with. You have worked outside of COVID on kind of understanding vaccine confidence along its whole spectrum of manifestations, and that would be really interesting as kind of as an example and as to demonstrate how communicating about health issues has been affected by COVID. Possibly one of the biggest, we've just talked now about scientific facts about the pandemic. Let's turn to the other side of things, which is the infodemic, brought on by the conversations around vaccines. So I'll hand over to you, Pauline. You've got a few slides. You've got a presentation to illustrate a bit more your work, and then following that, we can reconvene and take a few questions as well, and so put this in more sharp focus. So over to you, Pauline.
Great, thank you. Can you hear me okay?
Yeah, absolutely. Thank you.
Lovely. So so I'm taking this question: how has COVID-19 changed the way in which we communicate about health or medical issues from this vaccine confidence perspective? And I've been researching vaccine confidence for the last 10 years. The Vaccine Confidence Project at LSHTM we're celebrating our 10-year anniversary. So everyone's lives have been disrupted and impacted by this pandemic like never before. And a vaccine is being developed and produced much faster than previous vaccines. The public have received a basic 101 on epidemiology, all these, usually my friends don't talk about epidemiology or vaccine acceptance, whereas now everyone's talking about it. Everyone's talking about it for the last year. People know what an R number is, a reproductive number. So the public's knowledge kind of base of pandemics, epidemics, disease has really increased throughout the last year. And also anytime there's any results from any vaccine trials, they're in the news. Whereas in the past with other vaccine trials, they wouldn't have made the news as much as with coronavirus, as you'll all be aware here participating today. With every outbreak is accompanied a wave of information. And with information will also be misinformation, rumors. And Dr. Tedros Adhanom, the Director General of WHO, warned against an infodemic of rumors and misinformation that needs to be fought alongside this pandemic. With the internet and social media, individuals are more informed and empowered than ever before. However, they're all also more exposed to misinformation, information overload, conflicting information. With the internet, you can pretty much find any information to reinform your pre-existing views. And that's what research has shown, that that's what people tend to do with the internet, is that they have these pre-existing views and then they find information that reinforces those. With social media and the internet, concerns can spread quickly and far. Also, people who weren't previously able to can group on the internet, so you can find other people with similar views to you. And we conducted a study at the Vaccine Confidence Project with other colleagues where we looked at whether exposure to misinformation affected intent to vaccinate. And this study found that, yeah, it did. It was in the US and the UK. And we found that being exposed to misinformation around coronavirus vaccines made people, well, there were less, it decreased the number of people who are willing to be vaccinated. So that's something to be aware of, because although there's a lot of research showing that the general public trust doctors and trust public health officials, the majority do, they do go to the internet. And although the majority don't trust the internet, we have found through this study that misinformation on the internet can affect people's willingness to take a vaccine. At the Vaccine Confidence Project, we conduct social listening, and so we track conversations around chosen topics across social media platforms. We don't just look at what are the conversations. I mean, that's one of the main things. So what is the topic, but also where are people talking? So which platforms, how big is the conversation? So how many mentions does the conversation have? What is the tone, the sentiment? Is it negative, positive, neutral, kind of ambiguous? Who's leading it? So who are the main influencers of conversations? Who's participating in the conversation? So who's the audience? And then not just like reach. So some posts, when we analyze, have a lot of reach because, for example, that person or organization has a lot of followers. We also look at which posts, which content has the most engagement. So is retweeted, for example, or talked about, or shared with or liked. So it's that kind of side of it too we look at. We're conducting a project with UNICEF, the Eastern European and Central Asian Regional Office, and we're conducting some social listening in 16 European and Central Asian countries, the ones that are highlighted in blue in this map. And we're monitoring conversations around immunization, but also conversations around coronavirus. So conversations around vaccines, but also public health interventions, social impact, illness, treatment. We're exploring what are people talking about online. And this just gives us an example of what we're doing this. I think at the beginning we were doing it bi-weekly, and now we're aiming to do it monthly. But for a report that was over 2 months, so December and January, we analysed 4 million mentions around coronavirus on social media in these 15 countries. And just a few brief highlights. So what we've noticed is there's been, throughout the pandemic, there's been a shift in conversation from a focus on public health interventions to coronavirus vaccines. And also, it was interesting. So initially, in the first wave of the pandemic, I guess it depends where you are, religious figures and sports stars were the most important influencers across this region, whereas more recently, it's been media outlets have had a lot of reach and engagement, and also public health authorities as well have been important influencers. And something to be aware is not everything is negative that people are talking about, and misinformation is only a small proportion of information out there. So in our analyses over these 2 months, only 1.2% of posts contain misinformation. And in terms of misinformation, I won't go into details because I also don't want to propagate it, but just to give some examples. So conspiracy theories about 5G or nanoparticles or mind control with the vaccine, and also misinformation around natural or unproven remedies as well, that some might prevent COVID, and some they're saying they will, but it's unproven, or that they might treat it. And we're conducting, as well as part of the Health Protection Research Unit in Immunisation at LSHTM in partnership with Public Health England, we're conducting social media analysis, and we're looking at conversations and attitudes in the UK towards coronavirus. And this gives you a bit of a flavour. These are publicly available on our website if you're interested, and this gives you a flavour. So this is looking over time from, we started last January, so this is last year. What conversations were around. So initially there was a lot of conversations. This is in England in English. So there was you can see the green bars pretty high at the beginning, the green line. That's lots of conversations around lockdown. That first lockdown, everyone was talking about it online. And then more recently, the pink. So more people are talking about the COVID vaccine due to, the announcement that Pfizer vaccine was 90% effective. Authorization of vaccine and so on. As the vaccines have been rolled out as well, there's been more discussion about it. And in terms of more concerns and frustrations, we've seen frustrations about, initially, so in England, there were frustrations because mask wearing was seen as ineffective and people were told not to wear them because there was a shortage. One of the reasons. And then they became compulsory. So there was that frustration, but also more recently, frustrations that even if vaccinated, you still need to wear a mask, you still need to socially distance, because maybe there was that misperception that once you're vaccinated, you wouldn't need to. There were concerns about dosing schedule in the UK. The dosing schedule was changed. There was a change in the program. The dosing schedule was, so the time was increased between doses, but so there were concerns around, that hasn't been proven by the manufacturer initially, although now it looks like it's good in terms of it increases effectiveness to have a longer gap between the doses. And also, as we've discussed already, more recently, there's been negative sentiment. And we had a quick look, we haven't done a thorough analysis, but on the 11th of March, when Denmark and Norway suspended the AstraZeneca vaccine due to the safety signals, we've seen a spike of negative sentiment or concerns around the vaccines, and then a second higher peak on the 15th of March when Germany, Italy and France suspended as well. And it looks like that negative sentiment has now decreased now that the EMA has has said that there isn't a link with the blood clotting disorders. I apologize if I'm not using the right terms. It's not my area. So I then wanted to move on quickly to talk about acceptance around coronavirus vaccine. There's been a number of studies that have already been conducted in the last year, and this just gives you a bit of a flavor. I mean, it's not a representative sample, but just to show that acceptance around COVID vaccines varies by country. But this will change over time, and it will depend who you ask, and also how you ask them and how you record whether they're vaccinating, how you record it. So whether you, for example, categorize strongly agree to accepting a vaccine with like unsure but tending towards agreeing to get vaccinated. So it depends how you do that, but there is variation in acceptance. We conducted a study as part of the HPRU, this Health Protection Research Unit in immunization, where we explored, we actually asked parents of young children their experiences and views in the first lockdown to see about vaccinating their child with childhood vaccines. And while we were asking them about this, we also asked them whether they'd accept a COVID vaccine should one become available. So this was in April, May last year. And 90% said they would be willing. And the main reasons for willingness was to protect themselves, to protect others, to protect their family, to stay safe for their children, and to stop the need for social distancing. That was one of the reasons they came up with. And the main reasons they were more less willing to accept were concerns around safety, that it's a new vaccine. We've seen this with other vaccines as well. People are cautious with new vaccines, but also with this vaccine because it has been developed faster than previous vaccines, and also people were concerned around a lack of evidence, and also and also concerns around effectiveness. But also some people were saying no to the vaccine, not because they were worried about the vaccine, but because they're not in an at-risk group, so they want to leave the vaccine for other people that need it more. But one of the key findings as well that we found was that Black, Asian, Chinese, mixed, or other ethnicity respondents were 3 times more likely to not state that they'd accept a vaccine, and also people from lower income households. And we're conducting a study at the moment with health and social care workers. We're in the middle of the analysis where we're trying to try and figure this out as well. Why there might be ethnic differences. So we're exploring that in our current study with health and social care workers. So as part of this study, as I said, our main aim was to look at views and experiences of accessing routine childhood vaccinations in England, and almost 1 in 4 had experienced issues or difficulties. So there was a lack of clarity around vaccination services, difficulties in organizing vaccination appointments and not knowing if it was happening or not. In England, you'd get this generic text message from your GP, your general practice, saying, don't come, we're closed, call us or look online. So if someone had booked an appointment for their child and then they received the generic, don't come to the practice, it's closed, that was a bit confusing. They didn't know what to do. And also fears of contracting coronavirus while attending general practice. And we interviewed mothers as well. And so, for example, one was saying, listen, I had my baby 2 months ago. My mother hasn't even met my baby. I haven't seen anyone. I've just been at home. So I don't think I'm going to go to the GP because I might catch it there where sick people are going. And I might just delay it a little bit. So that was her view, for example. And uncertainty at what measures had been put in place to keep patients safe. So in terms of our recommendations, clear and strong national and local level communication messages are really important from the government, the NHS and public health bodies. In England, the message hadn't been clear because they were still deciding what message to put out there. So some general practice officers didn't know. So when mothers asked, they weren't unsure, the receptionist wasn't sure what was happening. And then there was clear guidance. And we saw that as our study progressed. The people that had vaccinated later on, it was clearer what was happening. And also calling the patient, sending text messages, letting them know what's going to happen. Because actually, those that did vaccinate were really reassured that everything was COVID safe. So, for example, they would wait outside. The waiting rooms were more quiet. So there was more space between appointments. Sometimes they were the only person in the waiting room. The staff at the general practice were opening the door for them, so they didn't have to touch anything. There was hand sanitizer, there were masks. they were called earlier to talk through things, and then when they were there, it was just the vaccination, so it was faster. So all of this really reassured the patient, the parents of children, and so so that's really key. And just to finish, I just wanted to say, so with the COVID vaccines, it's essential for government, public health officials and healthcare workers to reassure the public with transparency, with accountability, with timeliness. There is that issue of if we don't know, then we won't say anything and we'll wait to know something. But actually the public need to know something, even if we're investigating it. And Gabriella was talking, WHO have done an incredible job. And also there's these myth busters that are great. If you haven't seen them, have a look at the WHO website. And the infographics of, myths that concerns people might be having around the vaccine or around the virus, and explaining the science behind it, like busting that myth. But so it's really important to also listen and engage, because although the public may have concerns that are, concerns that aren't real, but the concerns themselves are real. So we really need to acknowledge these concerns and address them when they arise. And in terms of online misinformation, so the pro-vaccine movement is much less nimble and responsive than there's a small proportion of anti-vax people out there or spreading disinformation, but they're very nimble and they go where people are, and they worry people where they tend to be on social media. So we also need to be doing that. We need to be on the platforms that people are going to and answering questions. And there have been collaborative efforts. There are, between platforms and public health agencies to detect misinformation, to reduce it or remove it, make the user aware, to counter misinformation, and to direct users to official sources. You might have seen it if you search for something on Twitter, then your public health organization will come up first, and it'll like some signposting to official sources. That's it for me. I look forward to the discussion. Thank you.
Pauline, thank you so much. I love how you ended that talk with those 3 words, reassure, listen, acknowledge, and that really echoed what Gabriella was saying, also Elizabeth, about how if one thing's come out of this, it's that it's really a collective effort in terms of communicating. It's about having everyone in the conversation, for the better, for the worst, and it's wonderful to know that although there is a lot of the internet and the way we communicate now, particularly since we've all been in lockdown, there's a lot of online conversations, but at the same time, the tools you have shown us and the amount of detail and scrutiny that can be done on these online conversations is very reassuring as well, and certainly could be really applicable in other realms where there is misinformation. And for this neglected tropical disease audience, I'm even thinking of rumors during mass drug administration campaigns and other kind of healthcare programs. And we'll be hearing more about that tomorrow from MNC Saatchi and some misinformation in COVID campaigns that they've been running. So thank you for highlighting that. We did actually try and invite the social media platforms to this specific panel, but I think they've been under so much scrutiny that they were probably terrified. But they have, interestingly, also put in their own mechanisms, which may seem like small things, but I've noticed it's harder to share a headline that you perhaps haven't had the time to read yet. So an article, if you're trying to reshare it without clicking on the link first, the platform will flag this to you. And so, yeah, they've also been very active in this space. So I suppose before we move on to a few questions that have come up, and everything you've spoken about has elicited a huge amount of questions, certainly from my part as well. So there'll be many of those, but perhaps we'll turn to Steve for a few minutes. Steve, you're in the crossfire as the creator. You are there to translate all that complexity that we've spoken about in terms of the science or the public health program, the very diverse and complex communities affected, and you somehow in your magic black box have to turn that into a wonderful piece of creative content, a film, responding to more and more demands. People are after quicker messages, shorter contact. It has to be punchy. My home's been overtaken by TikTok over the lockdown, so my attention span's about 15 seconds. But yeah, anyway, over to you, Steve. We'll be more than happy to see some of the work you've been doing recently, and also what has changed for you since the COVID pandemic.
Perfect. Okay, let me just screen share first to get my presentation going. Okay, does that work for you? Can you see it?
Yep, perfect.
Thank you. You hear me? Great. Brilliant. Well, thanks very much, Marianne, and thanks to Elizabeth and Gabriella and Pauline for their fascinating contributions. And it ties in with what I'm about to say, so I'm kind of relieved that I wasn't alone in my thinking. So let me introduce myself. My name's Steve Maud. I'm a filmmaker, and I have a video production company called Cloud9 Media based in West London, where I'm sat today. I used to be a traveling cameraman. I've always enjoyed human interest stories and the chance that it gives to get an insight into other people's lives and share those insights with others. And global health is kind of perfectly suited to this. We've been in the neglected tropical disease game for nearly 10 years now, specializing in NTD storytelling right across the board, from diagnostics to donation programs to government ownership and local empowerment, covering schisto, onco, trachoma, LF, STH, Hansen's, hydrocele, leishmaniasis, you name it, we have actually filmed it. I started off my career in global health actually working for Comic Relief, traveling to Uganda and to Kenya and many other African countries, making appeal films to help raise money for Comic Relief's charitable causes that has since gone on to do great things. The formula that emerged from Bob Geldof's Band-Aid event in 1984, you could say, put Africa in the public eye and kicked off the idea of sending celebrities out to represent the hardship stories of locals. And they were needed to contextualize these stories for Western. It was a very new field. But unfortunately, in my opinion, it also helped kind of compound the image of Africa as this helpless continent and in need of aid. And then along came NTDs. This is a community drug distributor distributing for trachoma, and she doesn't look very helpless to me. So sending celebrities is fine for the wider public, for fundraising, etc. But NTDs have brought a new approach to disease control that has involved many stakeholders, each playing a vital role. It's a fascinating area because it's multi-disciplinary, many different partners, and everyone has an interesting story behind it. And the success of NTD elimination has been about the kind of convergence and finding the meeting point between all of these players. Interventions are very much around alignment and helping people help themselves. So the public donation model really isn't enough to see this through. And for us, that means helping the people behind the success of these interventions tell their own stories. So they reflect the true situation, which is good and bad. They bring authenticity and consequently drive more engagement with far greater likelihood of sharing, as Elizabeth said, of sharing both locally and globally. For us as storytellers, drawing on the personalities behind local solutions gives us a personal hook. It gives a context, it links together the key players, and it provides a great platform for telling meaningful stories and keeping the interest really through empathy. So we've developed and tried and tested a process for capturing these remote stories and sharing with the wider audiences, which I've honed over the last 10 years. And until COVID-19, that still involved us going out there to do the filming. But then COVID came along and the music stopped. I have to say, it was a very welcome time of relaxation. I remember last year after ISNTD, just back from Nigeria, and it was very busy. And in a way, that was what the world needed, was that pause to take the foot off the accelerator for a second. As the pandemic went on, it's highlighted the gaps in universal health coverage as we've seen such a wide difference in the capacity of countries to respond to COVID and all the other things that are going on that we love to read about every day. Yet for us as storytellers, COVID-19 has actually created a surprising opportunity in terms of global health awareness with the wider public. With many of us now having personal experience of this indiscriminate virus, experience of the impact of living in fear of a disease, and also interest in how to get out of this situation, we've noticed a marked increase in responsiveness to human stories of global disease success. It's what we've been doing in NTD intervention all along. I feel, coupled with the well-established success model of the drug donation model, mass drug administration, and the power of the community drug distributor, what better model is there for other health interventions? And in a way, I feel like we need to be looking to Africa and other countries that are, other continents that are running these programs actually for our answers, because the community-based health intervention works, and I wish we had this in the UK actually. However, COVID-19 also stopped travel, so I wouldn't be able to go on trips myself as I had done in the past. So I wanted to share with you now a way of how we are actually doing things now. So one of our new clients actually that we have the pleasure of working with since the pandemic, and we met through ISNTD last year, so thank you Cam, thank you Marianne, are the Foundation for Innovation in New Diagnostics. They wanted to document a new trial for a rapid diagnostic test for schistosomiasis. Now, schisto, like all NTDs, is another disease that's a product of its environment and its people. So we followed the Kenyan research team, KEMRI, running part of the running the trial for this new RDT in Kwale near Mombasa in Kenya. We looked at the success of the test and the impact it'll have on lab workers and the community and wider elimination efforts. Unable to travel ourselves, we went through the process of sourcing local filmmakers to capture the story. And George here is a good example of that approach in Kenya. Now, don't get me wrong, it's not an easy exercise trying to get to grips with the life cycle of two different types of worms, what the benefits of the test are, and then working out the sequences needed to be filmed to actually make a story out of the whole process that will be palatable to wider audiences that aren't necessarily in the scientific community, and that can relay the success of the project. So thanks to Zoom and document sharing and supportive clients, we've seen a great opportunity actually to collaborate more closely to really get the story right before boots hit the ground. And it also gives us a chance to really prepare for the unexpected, because without me being out there, I have to trust and rely on others. So full briefing is everything. And that's where the relationship with our local cameraman, in this instance, George, is so important. As I sit comfortably in the comfort of my home, he's out there getting to grips with the story and understanding the angle that we're going for, so that he's receptive to know what to look out for when on location. So really thorough briefing, good communication, listening and trust have been key in this. But it sets the foundation for a much stronger project when we actually start filming. Now, when I used to film, last year when I was filming in Nigeria, I had a small army of police escorts. I mean, literally. And I spent my whole time trying to run away and get away from them just to get the shots that I wanted. And I was constantly being told off by them. And I remember one of the guards said, he said, where are you from? And I said, England. He says, Nigeria is not like England. So it was a limitation. But by using George and local talent, we're able to get full coverage of the stories and build trust with community members faster. And for him as a local, he could bypass much of the red tape that I would get caught in, and consequently get closer to the topic than I could really ever do as an outsider. Personally, we've also found an incredible access to filming where communities are following safe COVID protocols, whilst remaining very much active, and in a way much more than us in the UK, stuck here in our homes in lockdown. And I think that there's something about the decentralized nature of African health systems that lends themselves really well to keeping the show on the road in spite of limitations of the pandemic. And honestly, and every time we've reached out to people, people have just said yes, and they've done it safely, which has been refreshing and reassuring. So the actual shoot from Kwale is now in the edit with our editor, ready to bring out their story. It's about telling their stories, and we are really just like the vehicle that adapts that to wider audiences, so they can gain wider traction on a piece of really important innovation that will have a major impact in the race towards NTD elimination. So out of this, what we've essentially in conclusion found is that COVID has naturally tipped the balance in favor of local voices telling local stories by cutting us out of the physical filming, bringing things more in line with WHO NTD roadmap onus on sustainability and inclusion. And there's never been a greater appetite for the heartwarming success stories of NTD elimination. I mean, let's face it, we need some good stories these days, and they are out there, they're happening. People are doing stuff, and they are actually making a difference, triumphing against adversity. With streamlined workflows, we're now producing content quicker and at much higher volumes than ever before. And it literally goes from the field, George will upload his footage, it goes straight to the editor. So I don't even kind of see the rushes sometimes. It's literally from there. And then we get straight out to the event. And it's so important not to miss these kind of key opportunities to get these more human interest stories out to the wider public with big kind of key days. I think today is World TB Day. Was it yesterday? I can't remember. Our reservoir of local talent has deepened as we collaborate with poets, photographers, filmmakers, musicians across Africa to find new ways of telling stories and really drawing inspiration from them and opening ourselves out. It's like a very different approach, and really it's and we are part of a growing global community that's based on respect, trust, and mutual understanding as never before. At a time of Black Lives Matter, colonial scrutiny, and the backlash of white saviorism, for us, this is a good place to be. Thank you very much. Oh, and if you want to, see the film as well, do sign up to us on social, and we can keep you posted on when that will be ready. Thank you.
Thank you very much, Steve. Such an encouraging talk, and lots to look forward to after the slightly serious and heavy topics that we've discussed earlier on in the session. We've always loved your philosophy and your eye, and what you've spoken about in terms of having locally told stories in a very representative and participatory way is something that is actually going to come up again and again throughout the festival over the next 2 days. So an approach that is increasingly endorsed by researchers themselves. If you are wanting to connect with poets and creatives, please don't miss several of our storytelling sessions coming up later on today and tomorrow as well.
Will do.
So lots to discuss there, and thank you, and definitely do follow Steve on all the social media. Always fantastic footage there. It's really interesting what you've kind of broadened the discussion beyond the COVID pandemic, just in general, looking at how creative content and communications can evolve, obviously accelerated with what you've described in terms of the big pause and the inability to travel, but it seems to be this very natural progression that's been accelerated. And I just wanted to ask perhaps all the panelists, first and foremost, sort of what have been moving a little bit away from COVID, the acuteness of it, but based on what you've seen this year, what are some of the shifts in how we communicate global health issues, scientific content, but also the story of the affected communities, whether they be in endemic countries or whether it's the communities right here in the UK where we are? Very broad question and a very broad topic, but if you had a few thoughts on that. So Steve, I suppose building on what you've shown us, I could ask you first.
How have I changed how we do things?
Yeah, or just in general, beyond your own acute work, how do you feel the creative process, the communication kind of process is evolving in a very general sense? I know you've put kind of the focus right on to having communities involved in telling their own stories. Is there anything else that you've seen?
I think to me the collaboration element is fundamental right across whether with our clients, and say with Find, we're working with the local Kenyan partners, and then we have the sort of science expertise as well from Geneva. But I think Zoom has made such a difference, and just to be able to look and talk to people is just, I don't know why we never did this before in a way. And so you just get a real sense of being there together, and people are so stressed and pressured. People are doing the jobs of many people sat in one fixed location without the stimulation of contact with people, the kind of human energy you get just from being in the room, and kind of collaboration on that front. So that people have got a lot on their plates, I think, and it's a lot to think about, the kind of strategies and how to take things forward. So at least kind of having the ability to collaborate, and also on documents, it feels like we're not wasting time. I feel like we're far more slick and lean these days in problem solving between different partners. So I like it. I just miss seeing people, and I miss going to Africa.
Absolutely. And I hear you. The staff at Zoom, I'm probably thinking, we told you could do this since 10 years ago. Very interesting. And Gabriella, I suppose your horizon has been completely dominated by COVID, but just thinking about maybe other diseases, other conditions, just in general, are there broader shifts in how we communicate about global health that you've seen?
Just a few thoughts on that. Firstly, it's really important for communicators to let people tell their stories. So I completely agree with that. And at WHO, we've done as much as we could to tell stories in countries of people's experiences, and not just in COVID, to kind of bridge to what you're asking about. One of the many tragedies of COVID is that the focus on COVID by health workers and others has meant people with other conditions have been ignored. Today is World TB Day. And WHO and TB partners are estimating that potentially an additional 500,000 people have died from TB because they haven't been diagnosed, they haven't been cared for. And this translates to all sorts of other conditions, mental and physical, that have been either neglected, or our health systems and health workers have tried their best, but you can't, if you have in ICUs and hospitals and so on overflowing with COVID patients, and you have health workers who are themselves getting sick or experiencing burnout, you can't also care for people with other conditions. Also, the economic toll of COVID has meant fewer resources for all sorts of conditions. And so one is worried about backsliding in progress against NTDs or malaria, TB, obviously, HIV. And then some of the inequities that COVID has exacerbated, whether gender inequities, that puts more people at risk, and on and on. So at WHO, actually, we're very worried about the full spectrum of essential health services. And actually, World Health Day is April 7th, and the sharp focus will be on broad health inequities. As Dr. Tedros said the other day at one of his press conferences, COVID has brutally exposed the grotesque health inequities that continue, that persist. And that's why we as a collective, as the world, all of us need to try to keep forging forward toward universal health coverage, adequate primary health care for all people. I mean, it's an essential human right. So I know I'm preaching a bit, but so I guess how is that relevant to communication? Is, you know, if you're immersed in the world of global public health, you see these things as obvious, but to other people, it's not so obvious. So, and then to some people who are suffering, who are neglected, who are marginalized, who don't have access, to allow them to tell their stories might actually help reach those who take health for granted, those who have what they need, those who aren't adversely affected by crises. So I don't know if that answers your question. Oh, I want to actually just take this opportunity for a little plug for vaccine equity. So we heard about vaccine hesitancy, vaccine resistance, misinformation. One of the really concerning things happening right now is that vaccines are being allocated in a very uneven way. You have a few countries that are moving toward vaccinating 100% of their populations, and many countries that either have no vaccines in country yet or have only enough vaccines to cover a fraction of their most vulnerable populations, their health workers, their elderly, etc. That is epidemiologically, morally, and economically, it is the wrong way to go. And a year ago, WHO and partners created COVAX and the ACT Accelerator as a broad platform and for vaccine equity, and countries and industry. Everyone said, yes, the COVID pandemic is going to be the health crisis where we don't do what we always do and ensure that the affluent are protected and the lower income people and countries are not. We were going to do it right this time, and now we're on track to not do it right. So those of you who are listening, we need your help to get the world back on track so that the most vulnerable people everywhere are vaccinated first, so that the variants, viruses and variants go hand in hand, so that the variants don't get the upper hand. It is false security if only a few places vaccinate their entire populations and the rest of the world is left behind. So just a plug, but it really is important. Thank you.
It's beyond important. It is the crux of the matter on so many different levels, and it's one thing to communicate messages, but ultimately there's some very real and very serious goals behind that, and so it's really important to mention those. So thank you very much, Gabriella. Absolutely. And we've had actually in the meantime a very interesting question here from the Liverpool School of Tropical Medicine. Steve Hall is joining in, and Steve is asking, perhaps Elizabeth, you might have some suggestions for Steve, but in this age of science misinformation, what are strategies to convince people who actually don't want to hear any science? How do you communicate science to people who don't want to access that information? And it kind of links back to what Gabriella was just saying, that there are some issues that we just all really need to know about and understand and need to be at the forefront of the collective discussion.
Well, I think as much as there's what can I call it? There are people who don't want to, or the perception that people don't want to listen or hear or read science. You find that they're the same people who go behind the social medias and to look for those scientific information. Their well-being at the end of the day. I want to take care of my health. I want to know what impacts me, and as much as I think one of the things that maybe could be fueling the how do I put this? One of the things that could be fueling the inacceptance of science stories or science information is probably for the first time we keep having scientific news and health news every single day, every single hour of the day. You find that if you scroll through Twitter, you'll not miss a story or two about the vaccine, or you'll not miss to hear someone mention or read someone mention or post about COVID. So I think the information overload is more of a thing that influences how people react or interact with science more than acceptance. For me, I think at the end of the day, you'll still want to know what is happening around you, and you cannot really bury your head in the sand and just assume that things will be okay.
Marianne,
Absolutely, yes. I was just going to turn to you, Pauline.
Lovely. So what we found is the majority of people vaccinate, and they may have some questions or concerns, but they vaccinate. It's like a bell curve. And then there's a small group that are very pro-vaccine, which vaccinate with unquestioning acceptance. But the middle, they might have some concerns, they might have some issues, but then they vaccinate. Whereas it's a really small proportion that really don't vaccinate. And the people who are really against vaccines, very difficult to change their minds. But the ones in the middle, you can definitely discuss, and it's really key to try and understand. And this is why we conduct interviews with people to really understand what are the reasons. And perhaps it's distrust. So distrust with the authorities that are communicating these messages. So it doesn't matter what these authorities are saying. If they don't trust that person, they're not going to agree with the message. So you need to get trusted community leaders you need to engage with trusted community leaders as well and have this conversation. It's really important. It's involving communities and try and figure out what the main reasons are, because you can't predict what it is. And you've got to be really careful as well, because in England, I think people who weren't vaccinating were called wackos on TV. And it's like, don't insult people for not vaccinating. Figure out why they're not vaccinating. Address those reasons, find the solutions, work together, and then it will be better for it afterwards. But I also want to second this equity issue and making sure. I mean, it's crazy that in England they're vaccinating people not in at-risk groups. I'm really kind of conflicted there because obviously if I'm offered the vaccine, I want to have it, but then I'm not in an at-risk group. I'm in my 40s. I want the vaccine to be given to people who need it as well. So, but it's really, I see there's a question. Sorry, I don't want to guide the questions, but what can we do to improve equity? What can we do? And we all need to speak out on social media with people we're working with collaborators. That it's so important that no one's forgotten.
Absolutely. And it's interesting you mentioned speaking out on social media, because I was slightly tongue-in-cheek maybe, but going to ask the four of you really. As you said, Elizabeth, even those who may not be seeking scientific knowledge actually will go on social media and find something sometimes that reinforces opinions and so forth. But is the solution for the scientific community to kind of also flood social media platforms with messages? There really seems to be a battle of volume of content. Should we be looking at volume as a collective scientific community to really put content out there, and therefore just kind of coming back to the general raison d'etre of this event? Is it now the time for the scientific community to take these creative approaches and communication a lot more seriously and embed that right into the scientific process from the beginning and not as a kind of add-on or afterthought? Steve, go on.
Yes. that's it.
Thank you.
Sorry.
Okay, so where would you start, Steve? Social media, do we want to there's been some great blockbuster movies about public health issues. Where do we start? What can every researcher do?
God, the thing is, it depends on your store, it depends on how much time you have, essentially. Because if we had all the time in the world, we would fill it full of content. And so I think it's down to sort of bandwidths for individuals and what they're trying to put out there, essentially. But I do think it's very important to think about like you say, the audience. A story needs an audience in a way, from my perspective. So it's very important to think of that right from the get-go, even right down to the events that you want to target. There are many different formats that you can use in terms of episodic, sort of short form content. Are you targeting Instagram generation? Are you going on Twitter, where people want to have different types of interest? And what are you trying to do with them? Are you trying to inform them, or just hook them and get them to extend your user base of supporters and things? So I probably haven't answered anything, but that's my take on it.
No, that's fantastic. And that kind of thought is echoed by Cameron Rafiq in the chat. Cameron's from the ISNTD as well. And Cameron's saying, as content generation changes from a television model to the Netflix model, do you anticipate the rise of global health content aligned to challenge misinformation? And Gabriella, will we see a WHO TV channel? Is there?
You want me to go first?
Yeah, sure. Is there room for really creative content of that nature at WHO?
So we've done concerts. We and partners have done concerts, classical music concerts, pop concerts, all sorts of kinds of music concerts. Dr. Tedros did a dialogue with Gillian Anderson, the actress, the other day. And our arts and health lead, Chris Bailey, on the mental health ripple effects of the pandemic. And we've spoken with various fiction and nonfiction filmmakers about things that we could do. Also, we're doing the second annual Health for All Film Festival, which is a film festival of short films, and we'll announce the winners May 13th. And we announced the shortlist Monday. I'm losing track of what day it is. So we are definitely immersed in figuring out creative fiction and nonfiction, multimedia ways to communicate. Also animations, data visualization, et cetera, et cetera. Whether we had a sort of digital streaming channel or something, I don't know. I'm a cord cutter, and I'm not sure how the new models would, how we would do that. Definitely series would work. We also, by the way, we have a series called Science in 5, which are 5-minute short videos where we explain in actually lay terms, just to loop back to what Elizabeth was saying, is explain to normal people in multiple languages things that are confusing to them, and we get their questions, and then we adapt these Science in 5 videos to their needs. So all by way of saying maybe, maybe there will be a TV, video, digital series, but definitely there's content already.
Absolutely, a huge amount of content, and very varied in style and tone. And in fact, we were very fortunate last year. Christopher Bailey, head of arts and arts and health lead at WHO, was present at the festival and gave us a wonderful 1-hour performance, one-man show, no props, no, just a very moving account of what it means to have arts and health. So we're watching this space and very excited about all that. I knew this would happen. I knew we would come to the sort of 88th minute of our panel, and we would have only just gotten started. Really, there is so much left to unpack and discuss. Some of the things that have been mentioned on the chat, we've sort of touched upon a lot of them. Jennifer Giovanoli was asking about, as you said, Pauline, asking about what can we do to promote vaccine equity, right to our politicians. A wonderful comment here from Wangari Wambui saying, going back to the community participation, involving the communities in finding solutions for societal challenges is a key aspect to success. In eliminating them, it gives the people a sense of ownership and responsibility, thereby building that all-important trust from the public. I like what Steve has mentioned about humanizing complex scenarios with people's stories. It's really noble and admirable. Kudos. And we'll be looking a lot more at that in the following session, which is called New Ways of Storytelling. But perhaps to round off our session, I'd just like to very quickly go once around our 4 speakers and just ask you, so, looking to the future, there's been a lot of changes. What would be your one thing that you would like to see improved, or what could we all do, just one simple thing to facilitate communicating about global health? What do we really need to focus on over the next 12 months? I see Steve and Pauline are looking really pensive, Gabriella as well. Elizabeth, you seem ready to answer. Perhaps I'll ask you first, sorry. What could we do to improve our communication of global health, or maybe to facilitate your work as a journalist? What would you like to see happen going forward?
I think Gabriella has mentioned this very well of her presentation. The issue of access to experts, access to the information that is being put out by organizations that are trusted, and the readiness of the experts to communicate to journalists and communicate to communication people, because this we are in the middle between the experts and the audience and the public, who are the biggest consumers of this public health information. So the access has increased and improved, especially in the last 1 year. I think I have not had access to Dr. Tedros as much as we have had over the last 1 year. The last time I had a sit down with him was in 2018. So you can imagine in 2020, you're having weekly webinars where all your questions are answered. And that has really improved or impacted on the stories that are told. And I think because at the end of the day, journalists and public health officials are the gatekeepers of information. And it therefore means that we have to maintain the principle of transparency, reliability, and trust. And really, if you break these principles, then if you damage these principles, then it has the potential of devastating. It has potentially devastating consequences. And for me, access has been very key to relaying accurate information.
Fantastic. Gabriella, your thoughts on this?
So everything, I 100% agree with everything Elizabeth said about access, trust, and such. And I just want to invite the public and the media to join our press conferences. They're usually Mondays and Fridays. Public can watch them on all our social media channels. Media can dial in on Zoom and ask questions. So Elizabeth, start asking questions. We always have a small subset who ask questions, and most of the journalists watch. And we want more questions and a broader array of journalists asking questions. And if anyone wants to reach me for any reason, my email address is stern@who.int, including some of you who in the chat have asked how you can help with vaccine equity. We'll have a new initiative starting soon where individuals can help us get to true vaccine equity. So thank you for the opportunity to join this